Normally, the anti-malaria drug, best known as Coartem, is a combination of two drugs, artemether and lumefantrine. Parasites responsible for the malaria infection have started to develop some resistance to one of the components of the drug through the gene's mutations. The other most important reason is to take the medicines not as prescribed by healthcare providers. Some people, including health counselors, believe that for them, Coartem is effective for malaria treatment, while others point out it's sometimes useless when they have malaria. In my opinion, Coartem is not good treatment. Quinine works better for me because then I can even spend a whole year without getting sick. I'm not saying that Coartem doesn't heal, it does, but sometimes people do not take it as prescribed, which makes it ineffective. Otherwise, it should be taken 3 days, in the morning and then 8 hours later take another dose. But when the dose is not followed, then it becomes ineffective. Coartem is what we all use, as I see no other drug other than Coartem to treat malaria. Yes, it really does cure. Dr. Mubito Pasco, the director of Muhima Hospital, says malaria is currently being treated in traditional therapies, including Coartem, but points out that those who do not find it very effective are the ones that don't take it as prescribed. If a patient comes to treat malaria and has symptoms, we can test and find that he really has it, but he doesn't take all the medication, especially like Coartem, which is supposed to be taken for 3 days. Then they take it on day 1 and 2, and when they feel relieved, they leave it. The next time they fall sick, they will say the drug is not effective. In Rwanda, Coartem drug is prescribed for malaria treatment at a 99% rate. The Rwanda Biomedical Centre says it is closely monitoring the involvement of malaria in collaboration with the international community to see how it can be addressed in Rwanda and other countries, and to monitor the delivery of medicines. Dr. Aimable Mbituyumulemyi, the director of malaria program in Rwanda, also called on the people to prevent malaria and to take proper treatments in case of illness. What is obvious is that one of the medications used to treat malaria, which is commonly known as Coartem, that is made up of two components, has started to show some weakness on some individuals because Plasmodium parasites responsible for malaria have developed some resistance to that drug, but the medicine is still in use for the treatment of malaria, even though there's been some weakness of the drug. People are urged to take the medicine as prescribed, as it still holds the power to heal. We also continue to monitor the drug day to day so that we would know for sure when the drug is no longer effective to those receiving it, so that we would change it early. People should not worry much. The medicine is still in use and can be taken as usual. According to the Rwanda Biomedical Centre, malaria is still a major concern for Rwandans in terms of the number of malaria cases per year, and is prevalent in all regions, and the fact that it affects all sections of the population, both adults and children. Some of the strategies in place to combat malaria, in addition to drug control, is that more than 5.2 million mosquito nets have been distributed this year. And at the end of this year, almost 7.5 million mosquito nets will have been distributed. There's also the planting of in-house medicine with a focus on the eastern and southern regions, with malaria cases declining by 1.5 million this year compared to last year. Last year, as many as 58% of people were treated for malaria by health counselors at home, which reduced the number of malaria deaths and acute malaria.